My name is Juan Alderuccio. I am a hematologist and lymphoma specialist at University of Miami, Sylvester Comprehensive Cancer Center in Miami, Florida. And during ASH, I will present our investigator-initiated study on a fixed duration of Loncastuximab Tesirine with Rituximab in patients with relapsed or refractory follicular lymphoma. In this clinical trial, we enrolled 33 patients with relapsed or refractory follicular lymphoma presenting progression of disease within 24 months from initial therapy, or those with meeting GELF criteria. That means a high disease burden at the time of relapse. In this clinical trial, we enrolled 33 patients with these characteristics. Majority of them were older of 65 years old and presented stage 3 or stage 4 lymphoma, follicular lymphoma at the time of relapse. Also, most of these patients presented a high tumor burden, and 54% presented a progression of disease within 24 months or POD24. In this clinical trial, we gave Loncastuximab associated with Rituximab. The first response assessment was done at week 12. Subsequently, the patient received 3 more doses of Loncastuximab and 1 more dose of Rituximab, and the new response assessment was performed at week 21. Those patients that achieve a complete response, meaning no evidence of disease on PET-CT at week 21, they discontinued Loncastuximab and received 2 more doses of Rituximab, and those patients achieving partial responses continue both drugs for a total of 18 more weeks. At the end of treatment, we performed the PET-CT, and all patients discontinued therapy at that time point. A total of 27 patients underwent response assessment, and the current data cutoff of November 26. The overall response rate was 96%, and the complete response rate was 85%. And the median progression-free survival has not been reached. And the 6 months progression-free survival was 96%, and the median overall survival of 95%. The toxicity, the most common were grade 1 toxicities. The most common was a decrease in the neutrophils, and also some anemia and low platelets, thrombocytopenia. However, no patients required blood transfusions during the study course. The non-hematological toxicity, the most common was increase in the liver function test, in the liver enzymes, specifically the alkaline phosphatase. Also, approximately 25% of the patients develop rash, skin rash, and photosensitivity. That is a common characteristic of Loncastuximab. And a significantly lower percent of the patient, approximately 12.5% of the patient develop fluid accumulation. That is also a known toxicity of Loncastuximab. However, the majority were grade 1 and manageable with diuretics such as spironolactone and Lasix that address that problem. Based on this data, the next steps is to develop a multi-center study trying to expand the current cohort beyond the 39 patients that were originally planned for this study to 100 patients to confirm the safety and efficacy that was observed in this single institution clinical trial.